Professor Ilan. Thanks for coming. Could you give yourself a quick introduction, please?
All right. Thank you very much for having me, Ben and Jeff. So I'm Yaron Ilan. I'm the chairman of medicine at Hadassah Hebrew University Medical Center in Jerusalem. I was the vice dean for the medical school and the former president of the Israel Liver Association. I'm very much involved in the field of liver cancer and chronic liver diseases, and I work with many companies, both large and small, over the last several decades. And I've been working with Cytovia and now with Naya over the last few years, helping them to get this product into patients.
Very good. So I guess I would love to get your take just with regards to like what's the current standard of care for HCC and what's the current unmet need there?
Right. So as you know, a few weeks ago, the Lancet has published the largest review up to now about HCC with all the projections. And as was mentioned before, the current global burden of HCC is around 1 million new liver cancer cases worldwide, but the trajectory is deeply concerning, and it is expected to increase significantly and even double over the next few decades, and also including the death rate. As I'll show you as I'll talk about in a minute, because of the bad response to the current therapies that we have, including the first line and the second line and the local therapies, we don't provide a solution to the majority of the patients with HCC today. So the death rate is really going to increase globally. Now, HCC can result from viral hepatitis B and C, which are now less in the West and more in the Eastern Hemisphere, but the increase of the metabolic disease or fatty liver disease, which leads to liver cancer, and we're all aware of the obesity epidemic, is expected to further increase the rate of HCC. Add to that the alcohol-related liver disease, which can also end up with HCC. We are talking about a growing epidemic, which is frightening because we don't have good therapies until now. So to answer your question, Jeff, what are the current therapies that we can provide to patients? There are many therapies, but people forget sometimes that most of the patients are not eligible to most of the therapies that we have.
Yeah.
So if you talk about curative intent therapies like surgical resection, only 10%, and some studies will tell you 25% of the patients are eligible to surgery, because in most cases we diagnose the tumor at a very late stage where the liver itself is always cirrhotic, and it's impossible to cut a piece of the liver because patients will die from liver failure. So, and then if you talk about liver transplantation, and if you go about the Milan criteria for liver transplantation, it's only about 10 to 30% of the patients who meet Milan criteria. Many of them are not eligible for liver transplant for other reasons. So the fact that we have these therapies, they are not helpful because most of the patients are not eligible for these therapies. So practically, it leaves us with some additional ablation or local therapies like TACE, which we are doing for local tumors. Mm-hmm. But the majority of the patients are eligible for the systemic therapies because they are not eligible for the curative or intended curative therapies. Mm-hmm. Now, if you look at the current guidelines for treatment, we have the first line and the second line therapies, and many drugs are in the pipelines. But if you just look at the number, you need to remember that the Atezobev, which is the most common first-line combination therapies, practically doesn't touch around 75% of the patients. So only 25 show some objective response. And if you go like to the lenvatinib, it's only 18%, 1/8 of the patients that show some response. 81% don't respond at all. And if you go to the second-line therapies like regorafenib and all the others, it's around 90% that don't respond. So if you look at the overall population, the majority of them are not eligible for the curative therapies at all. And then they go to the systemic therapies which practically don't work in the majority. So to answer your question, HCC has been an unmet need, but it's a growing unmet need. And this is why there are a lot of, that's why if you look around the globe, there are many, many attempts to improve the therapies that we have.
So one of the big reasons that immunotherapy doesn't